We're going to turn now to that major medical headline, the new treatment for obstructive sleep apnea. It's a condition affecting millions of Americans, of course. And joining us to break it all down is ABC News medical correspondent Dr. Darien Sutton. Good morning to you. So let's talk about this because we have Zepbound. It was already FDA approved for weight loss. Now FDA approved for sleep apnea. It's pretty surprising, right?
It's surprising, and it's also the first of its kind. There is no medication that exists that has been approved to treat sleep apnea. And just to help everyone understand, sleep apnea is so much more than just heavy snoring. These are periods of time when you're not breathing, without oxygen, and not treated. That increases your risk of diabetes, heart disease, dementia, and it's even been associated to a shortened lifespan. Now, on Friday, FDA has approved Zepbound to treat those with obesity and sleep apnea. In these studies, up to 40% of patients had full resolution of their symptoms and diagnosis, effectively a cure.
Oh my gosh. So what could this mean for insurance coverage and Medicare?
This is an ongoing conversation. When you talk about these injectable weight loss medications, Zepbound, same active ingredient as Mounjaro, similar to Ozempic, insurance companies often cover for the treatment of diabetes. It's been around for more than 20 years, but not often for weight loss. And so likely cost is a big factor here. More than $1,000 a month, more than 40% of Americans are considered obese. And also when you think about it federally, Medicare, Medicaid, the Biden administration has proposed a proposal to cover the treatment of weight loss, but that decision will be pending on the Trump administration. Cost is still a big factor here. The CMS, the Center for Medicaid and Medicare Services, estimates it can cost up to $30 billion over a 10-year period. But it's important to note that the CDC cites obesity-related health conditions cost more than $170 billion a year. Wow. So there's certainly a healthy argument for discussion here.
Absolutely.
Healthy argument. Thank you so much, Dr. Sutton, for being with us. Always a pleasure.